How about if there were an off switch? Do you have any friends or family members, or maybe yourself, that took the COVID shot and you're thinking, oh, if I had only known then what I know now, what do I do now? That's one of the common questions we get. What do I do now for myself, or my family members, my friends? Well, it's going viral tonight that Dr. Peter McCullough and his team may have found an off switch. He joins us now. Dr. McCullough, welcome back to the broadcast. Thanks for being with us.
Thank you.
So it's going viral tonight, and I know I'm wanting to hear it. I have some friends that took it, wish they hadn't, and they're scared to death. What good news do you have for us tonight, Doc?
McCullough Foundation fellow Nick Holscher teamed up with Diane Mariota, PhD, and myself, and we just published a peer-reviewed paper in the journal Gene Medicine regarding small interfering RNAs and another technology called Ribotech, which may be able to turn off Pfizer and Moderna. This is, of course, is a concept paper. It's an idea. Already several biotech companies have contacted us regarding putting this into action. We have one protocol, a concept, not turning off the RNA, but actually completely taking out the spike protein through a peptide infusion. The company there is called Neo7 Bioscience. So watch out for Neo7 Bioscience. So just like the COVID-19 vaccines have caused such a debacle for us in the United States, now they're offering opportunities for biotechnology solutions.
So what does that look like? Are we talking about a pill, a nasal spray, a shot, or a drink? What is this? What are we going to do? What are we going to take?
Likely an infusion or a shot. This is a long way from development. What I want people to understand is this isn't available, this year. What's available right now is McCullough protocol-based spike detoxification. That is, we have to hope and pray the body gets rid of the messenger RNA, and now it's our job to get rid of the spike protein, the dangerous product produced from Pfizer and Moderna. And there we use three natural products: nattokinase, bromelain, and curcumin. You can get these in any health food store or online. Nattokinase, bromelain, and curcumin. And we use those in combination over the course of about a year to relieve the body of the spike protein and help people get better.
Okay, so you didn't tell me to bring this up. You were just talking, and I thought, well, he is Dr. McCullough. He works with the wellness company. They must have something like this on their website. Well, so while you were on full screen, I went to the wellness company, and I think I just found what you're talking about. Is that it? Spike support?
That's the centerpiece. That's spike support. Now, the starting dose, 2 capsules twice a day, and we're commonly now going to 4 capsules twice a day. This is complemented by another supplement, bromelain, and then a third, curcumin. It's known as the ultimate spike detox. This is what people can do right here, right now. Go to the wellness company, twc.health. And there's a big membership drive now. They've opened up membership levels where there are unlimited supplements for people who pay a monthly fee. The One Wellness Elite also includes prescription medications. People ought to really look at wellness company membership. Get the supplements, get them for free, and take advantage of this. Now's the time to let the body heal after vaccination. McCullough protocol-based spike protein detoxification.
twc.health/Brannon, twc.health/Brannon to help support the broadcast. Now, let me go back to that. So if we have some family and friends that have taken this, did you say you should take it twice a day or 4 times a day?
No, it can be 2 capsules twice a day. It can be increased to 4 capsules twice a day. The key thing here, Brennan, is it has to be on an empty stomach. So you've got to find time during the day when the stomach's reasonably empty to take it. Some people actually, when they get up at night, maybe to use the restroom, take it then when the stomach is empty. I can tell you there are so many people now, thankfully, after about 6 months to a year, where their syndromes are being resolved. There's small fiber neuropathy, headaches, numbness, tingling, heart pounding. These are all the symptoms of long COVID and vaccine injury syndromes.
Okay, so I know someone that was in the medical profession, had to have 2 shots, and now has headaches. Hasn't had these reoccurring headaches until this. So I didn't know that was a sign, but you just seem to list that as a sign of some of the side effects of those who've had the shot. So you're saying this is what I should recommend to our friend.
Yeah, it's reasonable. Anybody who took the vaccines, any types of symptoms, this is a baseline. Now, other things can be added. For some of the severe craniofacial syndrome, some of them are really debilitating. We actually use a technique called stellate ganglion block. So here in Dallas, we have a partner who does this, a pain management doctor. Now, there's other syndromes where the chest syndromes where we add colchicine, autoimmune syndromes, we add hydroxychloroquine, persistent viral replication syndromes, we use prolonged ivermectin. So, but it's always on top of the base, which is spike support here, as well as bromelain and curcumin.
Okay, so I have a friend also, a couple that my wife and I are friends with, that are old enough to be my parents, and a lot of my friends are because they actually understand what's happening. You know, we can actually have a conversation about what's happening in the world. And so we were having dinner with them a few weeks ago on a weekend, and our friend, she said that her oncologist, she's struggling with some type of blood cancer. I don't know if someone shed on her. She was around people that had the shot. She did not. And then all of a sudden this stuff starts popping up. So I don't know what's going on there. But she has to go to an oncologist. Her oncologist told her that he is taking ivermectin regularly. Like, I don't know if it's once a week or how often it is, but he's regularly taking ivermectin as a way to stave off the big C, the C word, the cancer word. I mean, that's an oncologist. What is your thought on that?
Yeah, on the Courageous Discourse Substack, I have highlighted there are now multiple papers demonstrating preclinical models that ivermectin has anti-cancer properties. By the way, curcumin, in a sense, the spice that's part of the detox protocol, curcumin has anti-cancer properties. And these products are so harmless. They're natural products. A lot of people have said, listen, why not? And there are some alternative cancer centers, the Brzezinski Center in Katy, Texas, the Brio Center in Phoenix, Arizona, using them more in protocol format. But I think you're going to see, it makes sense. Through the pandemic, innovative doctors innovated with repurposed drugs, other products. Now we're finding spin-off applications.
There was something else she was taking, if I could find it real quick. I won't say where she was going to get it. But she went, I got so many pictures. I took a picture of the bag, and it was something that comes from the milk from a cow for the calf. It was in a bag, and she would mix it with water and drink it. Also thought to really fight. Was it called colostrum? That's exactly right. Thank you.
Yeah, colostrum is kind of the watery part of milk that's high in antibodies. But what this conversation is about is people are now much more open-minded to various natural solutions. Now, remember, hydroxychloroquine is a natural product from the Burka Cinchona bark. Ivermectin's natural from the soil in Japan. Colchicine we use extensively in long COVID syndrome. That's from the petals of a flower. Then, of course, nattokinase from fermentation of soy, bromelain from the stems of pineapple, and curcumin from turmeric. So, we have I'm a conventional MD, but we're learning this kind of bigger world of natural medicine.
Well, her oncologist was taking that and the ivermectin. And he doesn't have cancer. He just takes this as preventative, she said.
Well, there have been several reports now, people with cancer, and they're deep into it. And, why not give it a shot? So I had a man in my clinic with very advanced prostate cancer. He happened to have really prolonged COVID. He was on a lot of cancer drugs for his prostate cancer. But, the test we follow prostate cancer is the PSA. A normal PSA, Brannon, is like 0 to 4. His PSA was 200. Oh, my. And the cancer was all over. And so he was doing a lot of things. And I figured, listen, let's just put you on ivermectin because you have COVID prolonged. So I put him on prolonged ivermectin, I think over 3 months to 6 months. His PSA went down to 2.
What?
So I was astounded. Now, there are many other drugs could have played a role, but I think if doctors start to see successes like this, it's going to really open our eyes.
And how often would you take the ivermectin for someone like that? Is it
every day?
Every day. And I think this oncologist was taking it every day as well.
There needs to be large prospective randomized trials, of course, and we need evidence. But, in the field of cancer, where the timelines are really short and the drugs are so safe, ivermectin's safer than Tylenol. A lot of people say, listen, why not?
Because it's just going to flush through you. I mean, you can't have damage. It's not going to damage your liver or kidneys or anything else.
No.
Let me ask you about another study the McCullough Foundation did. And I had our buddy Dr. James Thorpe on, and I think you were his guest on the Worldview 2 produced broadcast we do here with Dr. Thorpe and Dr. Moon. You were just their guest. Your foundation, the McCullough Foundation, did a study, 112,000% increase in brain clots post-COVID shot.
This is astounding. It was actually heartbreaking to analyze that paper. The COVID shots cause blood clots in the brain, forms of arterial and thrombotic strokes, a terrible syndrome called vaccine-induced thrombocytopenic purpura. Today, I saw a man who was so upset. He's 78 years old, perfect health in Dallas, Brannon. He takes the shots. Now he's got a blood clot lodged in a critical artery going up to the brain, the vertebral artery. He's been to doctor after doctor that said nothing can be done for it. And he's so regretful. And that's what we're finding out here. We hope that with the detoxification, nattokinase and bromelain are forms of blood thinners. We may get ahead of these slowly growing blood clots and help people, be relieved of this risk over time. These things develop months or years after the shots.
Of course, we also mentioned the wellness company and the medical kit, which has ivermectin in it. And there's others, folks, if you just go to twc.health/Brannon, go to the top of the page, you'll see the different kits. You see a lot of them lined up behind him on the wall there.
Yeah.
But I want to ask you particularly about seeing a doctor. Here on the website, I just brought it up, twc.health/Brannon. Virtual care, see a doctor. So people are watching tonight, they're listening tonight, say, well, I don't have an oncologist I can go to like Brannon, like you're talking about your friend has. I don't have an internist or cardiologist like Dr. Peter McCullough in my area. Tell me how deep of a medical consultation can be done through the wellness company with you and Dr. Thorpe and your team. What does that look like for those who maybe want to try out the telemedicine?
The telemedicine currently is general care. So to handle the general problem, high blood pressure, cholesterol, the infection, and then referrals are made from there. But there are aspirations to grow it from that point forward. So I'm an independent practice now in Dallas, and so I certainly take referrals, but I'm so overwhelmed, Brannon, I have to see them face-to-face in the office. That telemedicine as a first entree is just not feasible. I'm just dealing with such critical patients. But let me tell you what, if you're on a weekend and you've got a skin infection or a bladder infection or a pneumonia that's amplifying, the wellness company telemedicine service is a lifesaver. I mean, you can really get on there, get some diagnosis, get some labs ordered, x-rays, have follow-up, medications prescribed, pharmacy gets it shifted out to you right away. And so the medical group is busy. And it's every day. It's 24/7.
Do people just join? They just join a membership? Is that how it works?
Yeah. Well, what I suggest is people should get the One Wellness Elite membership. This is a great deal. It's under $100 a month. Free supplements, as much supplements as you want with that membership. Free telemedicine. Look at the One Wellness. The top one, I think it's Premier or Elite. Look at their Elite. So free virtual care, free prescriptions, and free supplements. $9.99 a month. You can't beat that, Brad.
Oh, no, you can't.
I'm going to get it myself because I just started it because I'm on some prescription medicines. Just to have my medicines covered alone and my wife's medicines is going to be worth it. It's better than a prescription benefit for insurance. And then the supplements, because you're on 2 or 3 supplements, and I tell you what, these supplements are excellent. You'll easily save money with just a monthly payment of $9.99.
Wow, look at that, folks. twc.health/Brannon. Okay, final question, Dr. McCullough. How many of your colleagues since COVID have you run into who were critical of you, thought you were maybe over the top or going out there on a limb, who now have come back around and said, oh, Dr. Peter McCullough, I should have been listening to you. I'm sorry I was critical, or or I maybe didn't criticize you to your face, but in my mind I was thinking, oh, that's nuts. And now I realize you were so far ahead of the curve. I'm so thankful for your work now. Are you seeing converts?
No, I'm not seeing full capitulation like that, but
Really?
I just got a call before I got on from a surgeon. California said, I've been following you the whole time and you were right. And I just need to tell you that. And, people are coming out slowly who have been on the sidelines, but I'm not seeing that full capitulation. I mean, listen, in 2019, I was, the named guest lecturer at Harvard in both nephrology and cardiology. I was, gave grand rounds at the Mayo Clinic about 15 years ago. I mean, I should be back on the grand rounds lecture circuit, and those invitations are not coming yet.
So what does it say about our doctors and our medical doctors when they, after 4 years now, they can't even bring themselves to say I was wrong? What does that say?
You know what? When it came to hand washing, and it was pointed out they should wash hands to stop it, prevent spreading infections, it took 20 years before doctors admitted they're wrong. Smoking causes lung cancer. Doctors were smoking and advertising cigarettes. 20 years before doctors admitted they're wrong. And now the opioid pandemic, and it's going to cause problems. It took 20 years for the doctor to say, oh, yeah, now opioids are a problem. I think this is going to be a 20-year period of time. We're not seeing, there's not a single chief of medicine that's come out and said they regret the vaccines and are wrong. And it's going to happen, but boy, it's been a long time.
I don't know if you've seen it. Brown Institute today had an article, September 5th, 2024. Trust in doctors and hospitals plummets. A new paper in JAMA analyzed a survey respondents in the U.S. over the period of time right after the COVID pandemic started in April 2020 and through early 2024. It reveals a significant decline in trust in physicians and hospitals, dropping from 71.5% in April 2020 to 40.1% in January 2024. Lower trust levels were strongly associated with reduced likelihood of receiving COVID-19 vaccines and boosters. Total shocker, right? Question mark.
Well, you know what that means is the patients like me and you who didn't take the vaccine, we don't trust going into hospitals, and we shouldn't. People are afraid that they're just going to be jabbed, when they're sedated. This is all about the vaccine. The doctors, the nurses, and hospitals never should have pushed the vaccine. It should have been free choice. And people got way over their skis on the vaccine, and now there's a loss of trust.
So what do you do if you have to go to the hospital or someone has to go? Do you have, I don't know if you can have a family member with you at every point along the way, but do you immediately have a letter that a family member types up and you bring with you that says no COVID shots, no boosters? What do you do? What do you give as advice to someone that says, I don't want to get in that position. I haven't taken the shot. If I have to go in, or if I have to go on an emergency, my family member rips out of their, purse or jacket a pre-typed letter that says, by the way, here you go. You got your living will. Can you not do this? Do they have to obey those kind of orders if you hand them to them?
Yeah, they do. My dad was in essentially a nursing home, and I did have that on the chart, no COVID vaccine. But an easy thing to do is just say you have an allergy, because they always, if you have a penicillin allergy, they can't give you penicillin. Just say, listen, I'm allergic to these, and they have to put it on the chart.
Yeah. I'm certainly mentally allergic. There you go. TWC.health. Is the website, twc.health/Brannon, and PeterMcCulloughMD.com, PeterMcCulloughMD.com. You still doing your regular radio show?
Yeah, every Saturday and Sunday, 2 p.m. Eastern. America Out Loud Talk Radio, McCullough Report.
Excellent. Always, Dr. McCullough, great to have you with us. A real privilege. Thank you, sir.
Thanks, man.
Dr. Peter McCullough, check in.